Welcome to Transit Unplugged. I'm your host, Paul Comfort, and on today's edition of our Comfort's Corner inside look at how COVID-19 is affecting public transportation and paratransportation, we have a great episode today. We've got, this is the week of April 6th, and we have today headline news from what's happening, some good news that's happening in transit agencies around the country, as well as an interview, a newsmaker interview with Jeff Zarr, who's one of the most connected guys in the paratransit industry. I thought today we'd focus on what's happening with demand response and paratransit systems across North America, and he gives us insight into how they're responding. And then happy also to have David Pickeral, who is basically mobility specialist extraordinaire, who wrote chapter 24 for our book, The Future Public Transportation. He reads a portion from his chapter, which is entitled Q&A with David Pickeral. So all that is on today's episode of Transit Unplugged, the Comfort's Corner edition. And today I wanted to kick off with some good news. I've noticed that a bunch of transit agencies around the country are basically helping to deliver food. I'll highlight one of them, the RTC. My friend MJ Maynard is the CEO there. The RTC in Las Vegas and Southern Nevada is working with 3 Square Food Bank to deliver food to seniors in the community in an effort to ensure those who are unable to leave their homes can receive essential goods through its food bank's senior hunger program. As paratransit ridership has decreased during the COVID-19 pandemic, the agency found an opportunity to use vehicles to continue to serve the public, and they're thanking MV transportation drivers who accepted the call to help their community, making them, quote, the heroes of the day. MV is one of the many subcontractor companies around the nation that have over 100,000 drivers under contract with transit agencies, and many of them are doing very similar things, helping out the transit industry and helping folks who are their normal riders. Some smaller systems around the country, like my home county, Queen Anne's County, Maryland, County Ride, a transit system that I helped found 27 years ago. County Ride has changed all their routes to demand only in Centerville, Maryland. They announced that all fixed routes will be transitioning to a demand service only. And this means that while there will not be a bus making time stops along these routes, you'll still have the ability to get from one location to another. As long as your needed transportation is for essential travel only, they ask you to call the office with as much notice as you can, and a demand bus will meet you to take you to your desired destination. The locations where we're picking you up, they say, and delivering you must both be locations that the fixed route bus would normally be passing. And the change is being made to ensure a higher degree of safety for both the clients and the drivers. And I've noticed this in a number of mid-sized transit systems and smaller systems, that some of the fixed route work is just being transitioned over to that. Other adaptations to the environment. In Denver, portions of several Denver streets were closed over the weekend to vehicles to allow for pedestrian and bicycle traffic as residents weather the city's week-long stay-at-home order to combat the spread of the coronavirus. They want to encourage folks to get outdoors and enjoy themselves. The mayor, Michael Hancock, said in a video, whether you're walking, taking a nice jog, or a nice bike ride, do us all a favor, he says, practice physical distancing. It's extremely important. No matter what street or road you're on, it's important that we practice these guidelines. So they've opened up some of the streets over the weekend to allow that exactly to take place and give people a little more room, so to speak, to move around. Other agencies are taking interesting tacks. The Greater Cleveland Regional Transit Authority, the RTA, is beginning to use ultraviolet technology, UV-C, to disinfect high traffic areas, canine vehicles, and rooms with sensitive equipment. They've got some ultraviolet technology in which they can use that in response to an incident that requires a bus or train to be removed from service and disinfected immediately. RTA cleaning crews will also be able to use this technology to enhance their cleaning procedures at the bus districts, rail stations, and office spaces. It's a lightweight mobile unit, and it's safe and can plug into a standard wall outlet. And they say that UVC rays can disinfect the bus in less than an hour, according to Flonzie Caver, RTA's Deputy General Manager of Operations. And they say it's especially effective for disinfecting vehicles used by transit police canine units because chemical disinfectants are not well tolerated by the canines, according to Caver. So that's another interesting approach that folks are starting to tune to technology to use them. Also, just another interesting update that came out over the weekend is that sources within the San Francisco Municipal Transportation Agency, MUNI, said that a list of remaining lines after service cuts would likely be ready for the service as of Monday, and they're going to stop running a lot of the routes in San Francisco, more than 70 lines, and they hope to have information out early this week on Monday to tell people which lines will still be in service. But again, this is a dramatic change, a dramatic impact on the transit system to make sure that they're able to help stop the spread. One of the places where it's hitting hard, of course, is New York City. And you may have heard that 22 New York bus and subway workers have died with coronavirus, and another over 1,000 are infected. But the city is still running severely reduced and overcrowded service, and that's been noted by some as a problem. So there's been more than, as you know, over 60,000 cases of COVID in New York, and the MTA is operating on a reduced essential service plan to get key workers to job. But people are concerned that that now means that the subway and some bus routes are packed full of people because they're running less vehicles. And so even though there's less people running, they still are kind of jammed in some of these vehicles. So that's a concern that I've heard expressed around the country. There's some agencies in Canada and even Houston that have kept service and in some cases even added vehicles to the line in order to make sure people can keep their social distancing. So all kinds of different approaches today on our headline news portion of the program. Thanks for being with us today on Comfort's Corner. And now we're going to get ready to move into Mike's Minute, which is a good friend of mine, Mike Bismeyer, who is kind of what we call a kindness advocate. And every Monday we give you Mike's Monday Minute, where he talks about maintaining kindness in this era where everything is kind of tense. We can still remain kind to one another, and he tells us why that's so important. Again, thanks for being with us this week. Stay tuned for the great rest of the show, and stay safe out there.
Hi, this is Mike Bismeyer, Regional Sales Director of Proterra, and welcome to Mike's Minute, where we talk about random acts of kindness, mentorship, and the importance of leading by example whenever possible, in the hopes that it will inspire others to pay it forward. It's been another challenging week in transit as the coronavirus continues to consume resources, time, effort, and bandwidth across the industry and each of our lives. It's times like these, however, when preparing for the worst, that we see the best in many people. Those employees, frontline workers, colleagues, and peers that continue to deliver every day and work to make a difference. Mentorship and leadership are not skill sets that you can simply assign. They're mannerisms or traits that we strive to emulate from those whose actions empower us. As we collectively continue to navigate through the COVID-19 crisis in the transit industry, I'm very excited about the character and actions of the industry's countless peers, their efforts, thoughtful initiatives, and continued tireless efforts. The future of public transportation continues to inspire. Have a great week, keep kind, and keep safe.
All right, we're with our headline newsmaker today, and that is Jeff Zarr, who is a senior consultant for demand response for Trapeze Group. Jeff is one of the most connected guys in the paratransit industry and considered one of the nation's experts when it comes to paratransit and technology. He comes to us today from Florida. Jeff, thanks so much for being with us today on the line.
Hey, Paul. Thanks for having me. I appreciate it very much.
Yep. Jeff and I worked together many moons ago at Washington Metropolitan Area Transit Authority, where we both were involved in running the paratransit service there. And that really is your expertise, right, Jeff? Tell us a little bit about your background in paratransit, et cetera.
Well, I don't want to, I'll try to be brief, but I've got 34 years in the industry. Started back at the Center for Urban Transportation Studies while I was a graduate student at the University of Wisconsin in Milwaukee. So over the years, last 30 years, have seen a lot of change in the industry, but certainly nothing quite like what we're going through here.
Yeah. So when ADA passed, 30 years ago, whatever, the Americans with Disabilities Act, it made paratransit or commensurate paratransit a civil right, which meant that people who could not ride a normal fixed route bus or could not get to the bus stop or whatever had a right to have commensurate paratransit. At the time, it was considered curb to curb, and now a lot of cities have gone door to door. And so you are in touch with dozens of transit agencies around the country on a regular basis in the last couple of weeks, and are talking with them about how they are responding to the COVID-19 pandemic. Tell us about what you're hearing as you talk to them.
Well, the number one thing that I'm getting from all of the paratransit agencies, and I'm connected on the lower levels too with operators. And, I have been known to hang out in the break rooms and just talk with the operators and get into reservations and scheduling. I like to have my, my boots on the ground. My roots are really in operations. So I spend a lot of time. And the number one thing is fear, really. It's fear. Many transit employees, found out during this pandemic that public transportation is considered an essential service. And, a lot of these operators have underlying health conditions and are, at the high risk group being over 60 years old. And unlike fixed route operators, paratransit operators need to come in close contact with the passengers. And if you think about the passengers that were traveling, a lot of these passengers have, compromised health systems and travel to and from medical facilities, and operators have to secure them in the vehicle. They traditionally go door to door. Some of that is changing depending on the facilities. Dispatchers, even that's our operators. Dispatchers come into contact with our operators, and then workstations, dispatchers' workstations are sometimes shared. You think about the dispatch window where the operators check in and check out every day. That's a shared work area. The vehicles are often shared, even though everyone's sanitizing the vehicles. But they're worried. They're worried that some part is going to be missed in the sanitation process. And then during this, there's the ripple effect, I would say, of decisions, personal decisions that just raise the level of anxiety. Will I have a job? There are a lot of operators throughout North America that are getting laid off. I mean, it's not surprising to see in the headlines transit agencies laying off 120, 140, 150 drivers. The demand for service is down as much as 90%, certainly well over half at all of the transit agencies. I was talking to an operator not too long ago, and he was saying, he's like, Jeff, I'm supposed to close on my house. He goes, I don't know if I should do that. He goes, this is the first house I'm ever going to buy, and I don't know if I'm going to have a job. What if I get the virus? So, others have kids in school. They're worried. They're very anxious about their health and their well-being.
It's interesting.
Yeah.
And what about the agencies themselves? So what I'm seeing, and I'm sure you're hearing the same thing, is that between 50 and 60% ridership decline for a lot of paratransit services. Some more, but the ones I'm seeing are about 50 to 60, which reflects what I'm seeing in fixed route, not commuter. Commuter services are down 70 to 90%, but for fixed route, that. So what are paratransit agencies doing? Are they restricting trip types? And are they allowed to do that under ADA, or are there ways around that? I know that you probably don't want to talk too much about that, but whatever you can tell us without identifying any agencies, what you're seeing.
Well, some agencies, many agencies are doing just essential trips, and essential trips would be, life-saving medical trips to and from work if they are essential services. So that is most definitely happening right now. I can tell you that this has been an evolutionary process, a quick evolutionary process over the course of a month, but they started with our own social distancing. And so some agencies wanted to give exclusive rides. So Paul, it would be just like you would be the only one on the vehicle. And so they came to me and said, can we just give a ride just to one person? I'm like, well, that's interesting. Normally,
yes,
you want me to help you, improve your efficiency. And now you want me to give a ride to a single person. I'm like, absolutely, we can do this. So, we implemented this social distancing to give exclusive rides just to that one passenger and maybe their personal care attendant. And then also limited the vehicles. Some of the vehicles are larger, and the transit agencies felt that they could implement this social distancing if they reduce the capacity of the vehicle in half. So been helping agencies respond accordingly to that. This goes back to when this pandemic first kind of came on the American scene. Most folks found out about this, at least in the transit industry, found out about this when we had the tragedies up in the Kirkland, Washington nursing home, where someone introduced the virus into the nursing home, and 10 or 11 of the people, unfortunately, passed away. When I heard about that, I went up to the Seattle area and started working with our friend John Gray, who's a general manager up there for one of the transit agencies, and also worked with King County, the folks up in King County, and sat and listened to them, tried to understand everything that they were going through, all of the response plans that they had to put together. And when I came back from that, I knew that this was going to be a very serious thing for my people, my public transit, paratransit people. And so we started giving webinars, and we've been doing this not only to share the best practices from an operational perspective, like the social distancing and things like that, but also trying to help them implement these with their technology that they have today. And some of the other things, very creative, that and it's typical of what's happening for most people, for most Americans, and that is we're all coming together and we're all helping in any way possible. And the same is true for these paratransit organizations. There are some folks who have just said, hey, listen, we're going to go pick up your groceries for you. Now, we're not going to take grandma to the grocery store. We're going to go get the groceries for grandma and bring them to her so she doesn't have to go out. So they started the grocery delivery, which is, that's not a new concept, but it certainly is for paratransit people to be doing this. But they were very connected to these people. They felt very comfortable. There's a very tight, I'll almost say, ownership of the operators to their customers, right? They treat these
they're like family.
As family, as their customers. Those are my customers. And so it wasn't unusual, and this happened very quickly for a lot of transit agencies, where they started delivering groceries. Then they started delivering meals, full cooked meals. And then they started delivering supplies. And then they started transporting health workers who were afraid to start taking public transit because that's how they got to work. And so they started transporting them in either one or two people per vehicle. And they're just helping out as best they can.
That's wonderful. Are there any other technology, I don't want to say tricks, but new tools, I guess, that people are using to help adapt to this new environment?
Well, a couple of things that we're doing is the vehicle's sanitization, is different than it ever has before. It had been before. We always clean, the vehicles were always cleaned, at the end of the shifts and everything like that. They come back to the yard, and either the operator would clean the vehicle, or they would have someone in the yard clean the vehicle. The cleaning of the vehicle is much different now, and these vehicles are being routed back to a point where they can get cleaned. If that's the garage, if that is a downtown transit center, but they're getting cleaned multiple times a day. So they're implementing these breaks, these cleanings, as part of the schedule, and it's working out. From a scheduling perspective, it's working out well, because these vehicles and the capacity overall of the system is way down. 50, 60, 70, as much as 90% for some of them. So we're able to work with that and have the vehicles circle around and get cleaned. As is the case on fixed route, this was primarily because they didn't want the operators or the passengers to come into contact with the operators, which is the fare boxes up in the front of the vehicle. They started using the rear door of the vehicle and not collecting fares. Well, that translated over to the comparable fixed route service, and the fares have been waived. Now, all of these things that we're doing, there's certain ways in the system that we have to record this, because a lot of this, there's billions of dollars, $25 billion became available. And some of these alternative type services, food service, meal service, transporting healthcare workers, transporting equipment, are all eligible to be reimbursed, but you have to track them, and you have to be able to demonstrate that you're actually doing this. So as I'm helping people put these measures in place operationally, we're making sure that we can track all of these so that they can get the proper reimbursement. Two other things that that have been pretty common, pretty prevalent, and that is the quarantining of locations. Certain locations we're just not allowed to go to anymore. These would be like assisted living facilities, nursing homes. They're just quarantined. No one's in, no one's out. There's no more trips to or from these locations.
Right.
And then we have the situation where people who have been infected and have been documented and verified that they have been infected have gone to certain locations. Well, those locations have to be cleaned. And there's some examples of dialysis centers where people who, again, we're dealing with this vulnerable population, people who are on dialysis tested positive, and they'd been going to dialysis 3 days a week. There's other people that are at these locations, so then we have to get back into, not only do we have to quarantine the location, which we do with the technology, but we also have to be prepared to do tracing, right? So who took grandma to the dialysis center? Who is the operator? What vehicle was on? Who else do we take to that facility? It's this tracing so that we might be able to determine who else might be exposed to the virus. So it's been a very, very busy time, and I work for Trapeze Software. Our customer care folks have been also stepping up quite a bit since the onset of the virus. Shortly after the first webinar that I gave after returning from King County, there's been a 30% increase in a number of cases that have come into our customer care, our support group at Trapeze. They are doing a fantastic job implementing all of these little tricks, and they're documenting everything because, Paul, someday, this is hopefully soon, this is going to be over, and we have to undo everything that we've set up. So as we're implementing these changes, we're documenting everything. The documentation itself is quite mind-blowing, just to see how they're documenting everything, and we're reaching out to every single one of our customers to make sure that we've contacted them and that everyone's okay, and to see if they need any help. Some of our customers are very self-sufficient and don't need assistance, but others, as witnessed by the 30% increase in support calls, are taking us up on our offer.
Very good. Well, Jeff Zarr, Senior Consultant for Demand Response for Trapeze Group, thank you so much for being our guest today and sharing with us what's happening in the world of demand response, paratransit, ADA across North America. Stay safe.
You too, Paul. Take care. Thanks.
And thank you for being with us today on Transit Unplugged, the Comforts Corner edition. Now we enter the portion where we have a chapter of our book, The Future of Public Transportation, the Amazon bestseller from last month, being read by one of the co-authors. That's right. So The Future of Public Transportation is a runaway phenomenal #1 bestseller across North America on Amazon. It is available for digital download as well as a hard copy for the book. Folks across the world are telling me how much they're enjoying it. I got lots of feedback from all kinds of countries, and most people feel like that even though the book was written before the COVID virus, it's future-proof generally, and most of the things that we're talking about are still relevant even today. Today, I'm excited to have David Pickeral reading a portion of his own chapter 24, a chapter entitled Q&A with David Pickeral. He's one of the smartest guys in our business. He has a resume as long as my arm, and he speaks to audiences around the world about the future of mobility in smart cities. And not only does he focus on technology, but also on how to make solid business models with it and the importance of regulatory compliance and clear governance. And so I asked him to respond to some just general questions. And so he did so, and he reads a portion of that for this chapter. Thanks a bunch for being with us today as we bring you every other day headline news, newsmaker interviews, and a read from our book here on this edition of Transit Unplugged, the Comforts Corner edition. Take care and be safe out there.
In response to Paul's question, what do you think is the future of MOS for our cities? I responded, mobility as a service or MOS, has in recent years become in many circles yet another overused buzzword, as well as suffering from association with ban-the-car extremism or usurpation by sellers of discrete products or services, entirely unnecessarily so. In the often maddening internet-era habit of having to distill everything down and create catchy labels in the attempt to capture the decreasing attention spans of an increasingly distracted audience, pundits, politicians, and productizers have often left behind, pun intended, what government, industry, and academia in communities around the world are now actively trying to do at the most basic level. How do we, with the resources we have or can reasonably attain, best use transportation technology and common sense to deploy them now and going forward to provide revenues for business, cut costs for government, and serve the needs of our citizens, constituents, and customers? Significantly, it should never be about eliminating personal vehicles, fixed route mass transit, or any other element of the value chain versus ensuring a seamless mix of options for each journey whilst avoiding the extremes of people either having to purchase vehicles to get around or spend their lives waiting for slow and inefficient scheduled route service to show up. In trying to talk about the next evolution of mobility, whether or not it is ultimately termed MOS, especially here in the U.S., in simple terms, I am inclined towards no less than a perhaps blasphemous inversion of our national motto, out of one, many. What exactly I mean by that is that I believe that it is fundamentally important that even as planning, selection, and payment functions are consolidated, perhaps in the cloud, again like MOS, an issue for another time, it will be fundamental that end users are able to reach them via their choice of a single point of access. But then, it will reciprocally be important to be able to deconstruct all of them when needed in an environment of neutrally allowing rapid, uncomplicated, and reliable selection and payment for one or more modes to cover each specific journey portal to portal. Mobility as a service will not be so much a service as it will a movement. Although the automotive world is finally shifting beyond the centennial mindset of everything as a product, recalling some of the most frustrating conversations of my entire career to that effect with OEMs on multiple continents, even the concept of a service does not entirely cover the landscape. No one entity, no matter how diverse, can enable this new mobility itself. Rather, it will take collective agreement followed by active collaboration across open standards, converging the optimal public and private resources for each community. This was and still is how the Internet has scaled across global ICT infrastructure and how transportation itself incrementally involved with local services networked with those beyond. MOS in every community needs to start locally and be done with direct engagement by state, provincial, transportation authorities, and national governments, providing high-level funding and, even more importantly, standardization, and with an industry and academia involved at every level. To Paul's question, what is the question you didn't ask? I offer, how do we resolve the conflict between private on-demand services and mass transit? The transportation technology world, and indeed the mainstream media, were ablaze with the news that Uber has incinerated yet another $5.2 billion in second quarter 2019, with as yet no turnaround in profitability. In practical reality, there have been two fires burning for some time. Half a century of data affirms that taxis make little ROI and mass transit none at all, indeed quite the reverse. Fanned by the TNC phenomenon, every U.S. MTA except Seattle and Houston faces progressively lower transit ridership and commensurately reduced fare box return year by year, a slow burn collectively costing taxpayers an order of magnitude more than the individual loss here. Eventually, the mobility market will believe those of us who have suggested for decades that on-demand services can monetize cost takeout over many low-density fixed-route operations. Let me explain exactly how this works. there is a 10% fare box return on a route, equating to a 90% loss. If it is possible to substitute publicly funded TNC, microtransit, or shared mobility from one or more private operators to reduce that loss to 80%, that differential can be monetized as both government savings and industry profit. That sounds simple, but in practical reality it is not. The real artifice and complexity will come using transportation technology including IoT, analytics, AI, CAV, and digital twin to gather and analyze ridership, VMT, passenger seat miles, and other data to deploy the right mix of services not only for each individual community, but each demographic within that community. In so doing, the ability to Pareto optimize, adjust G2B subsidies versus B2C recoupment to ensure that all populations are served and all providers compensated is eminently achievable.